Dr. Rachel Hurley, our state epidemiologist from CDPHE, Scott Bookman, our COVID-19 incident commander, CDPHE, Casey Carlton, our CDPHE Senior Solution Architect from the Office of Information Technology, and Dr. Eric France, our Chief Medical Officer at CDPHE. With that, I will turn it over to you, Dr. Hurley.
Great. Good morning, everyone. Thank you so much for the opportunity to share this information with you. I want to cover two topics today based on questions that we've been receiving from the public and from the media, primarily focused on hospitalizations and trends that we might be seeing here in Colorado around different age groups and hospitalization rates. Lots of questions these days around pediatric hospitalizations, and also getting questions about vaccine breakthrough hospitalizations. So those are the two topics I'm going to cover today. But starting here with hospitalizations by age group, this is a figure that's showing you our 7-day moving average rate of hospitalizations in the state, and we're breaking down those rates by age groups here. So in red, you can see all hospitalizations among adults in the state, and then below that, you can see the rate of hospitalizations among younger age groups. And so one of the things that we're clearly continuing to see is that the bulk of a burden of hospitalization in the state and across the country really does continue to be among the adult population. And as I'll show you in just a minute, primarily among individuals that are unvaccinated adults. But you can see that we have seen a little bit of an increase as well in some of our pediatric hospitalization rates. And if you go to the next slide, you can see that a little bit better. So here we zoom in and look just specifically at some of those pediatric age groups. So 0 to 5, 6 to 11, and 12 to 17. And here you can see that among those age groups, we have started to see some increases. We get lots of questions about, are we seeing an increase in hospitalizations among children because Delta is more severe, or is it simply that Delta is more transmissible among children than earlier lineages of the COVID-19 virus was? And it could be a little bit of both, but it does appear that most of what we're seeing in the literature right now is suggesting that the increased hospitalizations that we're seeing here in Colorado and across the country are probably primarily due to increased transmissibility. There's really not a ton of data available right now to suggest whether hospitalization rates are higher among children or not. We do have some data to suggest that overall hospitalization rates are higher in individuals, but it does appear that most of that probably is related to adult hospitalizations, but again, more information is needed. I also think a really important part of the story right now, as we are looking at hospitalizations among children in the state, is not just COVID-19, but starting in the last couple of weeks, we've really started to see not just an increase in COVID-19 hospitalizations, but also hospitalizations due to other respiratory viruses, mainly the RSV or respiratory syncytial virus.
The Sheriff's Office shared these emotional photos saying they're honored to support the families of those.
Are others hearing feed? Okay. And that, the increase that we are seeing among children, sorry, I got a little bit distracted. So the increase that we're seeing among children with respiratory syncytial virus is something that's also being seen around the country right now. And so as we move into the fall, I think we're going to be seeing not just increased hospitalizations among children for COVID-19, but also potentially with other respiratory viruses. So RSV, and then potentially as we move further into the respiratory virus season, influenza as well. Next slide, please. And then finally, as I mentioned, we've been receiving questions about what the rate of vaccine breakthrough hospitalizations are compared to total number of hospitalizations occurring in the state. And so this particular figure is showing you the 7-day average number of hospitalizations that are occurring among unvaccinated individuals versus fully vaccinated individuals. And this rate type data, we believe, is really probably the best way to look at this data right now. We believe that we're seeing probably 7 times the risk of hospitalization among unvaccinated individuals compared to fully vaccinated individuals when it comes to hospitalizations. And with that, I will hand it over to Director Bookman.
Thank you, Dr. Hurley, and thank you all for joining today. I do want to take a moment to once again thank all of the healthcare providers across the state of Colorado, whether you work in a hospital or a skilled nursing facility or a doctor's office. You have been on the front lines of the response to this pandemic for well over a year now. And as cases continue to rise, I really do just want to take a moment to express our gratitude for all the work that our healthcare providers have done and will continue to do in the coming weeks and the coming months. So I want to talk briefly today about hospital capacity. It's not a conversation that we've had for a while, given where we were in the course of the pandemic. As we have seen the Delta variant take over and we've seen cases and hospitalizations begin to rise, I think the top line message here is that we do still have a significant amount of hospital bed capacity across the state. As a reminder, at the peak last December, we had more than 1,800 people hospitalized with COVID at any given moment. As of today, we have just over 600 people hospitalized. So we have significant capacity available. We're also, given the increase we are seeing in our pediatric population, are beginning to work on a deeper dive into our pediatric ICU capacity and working with our healthcare partners across the state to ensure that we have good visibility into every pediatric ICU bed, every NICU bed that is available to us to ensure that we can maximize the use of those beds. The good news today is that while we have seen an increase in ICU utilization over the last 30 days, moving from 72% to just over 80%, we do still have significant surge capacity available in our ICU beds across the state. And on the next slide, we can see here our medical surgical beds, which actually have been very flat over the course of the last 30 days. And so clearly we have significant capacity in this space as well. Every one of our hospitals is at the table. We're continuing to have daily conversations about their capacity, partnerships in place to transfer patients if necessary. At this point, we are far from having to do that, but we continue to monitor it on a regular basis. And with that, I'll turn it over to Casey.
Great, thank you, Scott. I also want to thank everybody for the opportunity to talk about the latest functionality we've been able to introduce into the exposure notification apps that are in use within across the state. So the functionality that we've introduced is the ability to self-report individuals' COVID positive diagnosis. It's referred to as self-report within exposure notifications. And we're pretty proud to be the first state to roll this out within that functionality. Colorado was also the first state to deploy exposure notification activations en masse for all COVID positive cases across the state. And so this new functionality allows users who test positive for COVID-19 to share their tests without waiting for that code, which is activated through state lab reportings that we receive. We received community feedback that this was a way to empower users to notify folks about their exposure more quickly and conveniently than through some of the other means within the system. So in the next slide, we'll walk through what some of that user experience looks like from both the iOS and the Android screens. And just before we get started here, just before we get started here, I wanted to mention there's three main steps to it. Three key parts to it. It is for the user to know that they have the opportunity to self-report their COVID-19 diagnosis. Also that we verify that that user is in possession of their device where that exposure notification activation would be sent, and then to make sure that they get that exposure notification. So sorry about that. Let's go ahead and start again. This is the iOS experience where the user goes into settings within their iOS device. That's where exposure notifications are managed natively on an iOS user's device. They would go in, click the option to share their COVID-19 diagnosis, be presented with some information here about what that process looks like to be able to self-report and the next steps needed. We collect the basic information from users needed, which is a phone number, symptom date, test date, and we also collect test location because that's data that, again, anonymously enables us to understand how this functionality is being used. We see that they're proceeding through here now. There's also a acknowledgement that they know that this is a legally binding process, that their information they're providing is accurate. They receive a unique link from us so that we can confirm that they're in possession of that device where the activation link would be sent. And we let them know that we've received the information successfully so that they can expect that exposure notification to be sent from those national APHL servers. And again, once they receive that activation link here, it actually takes them back into their exposure notification app where they can proceed through the steps to share their exposure notification anonymously with others that they may have been in contact with. Throughout the process, we provide them a lot of information. These screens are customizable to what Colorado and CDPHE want to make sure that users understand through this process. And with that, that was an iOS user's experience in being able to share that information. We're going to go through it again here from Android, and you'll see some of the same steps. Within Android, the screens and the input are all within the native experience of the Android exposure notification app. So again, the user would go into their app and elect to share their COVID-19 diagnosis through self-report. This screen, they go through the process where they have not received a code from an LPHA or something, or a case investigator. Again, they share their phone information so we can verify that they are in possession of the handset where that activation will be sent. And again, basic information like test date and symptom date, which is used to ensure that those exposure notifications are activated within the parameters from our epidemiologists here in the state. Again, the legal acknowledgement that they are sharing accurate results. And they receive the activation code, which brings them back into their native experience. A few more screens to ensure that we collect the proper information within those activations. And they are guided through the process to share their exposure notification. So with that, hopefully shed some light on the new functionality, both from iOS and Android users. And with that, I believe I'll pass it over to Dr. France.
Thank you, Casey. Thanks for showing us how that works. I'll just share a quick story that my adult daughter was notified through exposure notification. I think it was Saturday that she had been exposed, and she was driving across the country to visit my parents. She stopped in Iowa for a quick test and was able to arrive with her result. And so we were very pleased to know that she was being notified about a potential exposure and could reassure her grandparents that she was negative. So a great tool, and I hope everybody in Colorado is using it. I wanted to just review the week because it's been a busy week when it comes to vaccines and vaccine recommendations. Our first recommendations came, of course, late last week when the Advisory Committee of Immunization Practices changed their recommendations for the mRNA vaccine to recommend that persons who have moderate to severe immunocompromised condition should receive an additional dose of the mRNA vaccine. And so for me now, I have a different framing of what it means to be vaccinated. Before, for the average person, 2 shots were recommended for the mRNA vaccine. Today, the primary series for someone with moderate to severe immunocompromised condition is 3 shots. And so going forward, we'll always recommend a 3rd dose 4 weeks after that, the 2nd dose of either of these. So now we have essentially new recommendations for the primary vaccines for persons with immune compromising conditions. really early this week. We've been giving doses. We've been letting persons self-describe their moderate to severe immune compromised condition at local pharmacies and other vaccination sites. And so we certainly are encouraging persons with these conditions to go get their additional shot. And then, of course, yesterday, new news as well, which was that the recommendations will be changing around this idea of getting a booster dose. So once you've completed your primary series, it appears that within 6 to 8 months, the vaccine's protection starts to decline or wane. And so giving another boost is preparing the vaccine, and I should say preparing your body for a potential exposure in the future. Think of this almost like getting ready for the ski season or for the hunting season, where you might go out and do some more extra walking so you're ready for what you might be coming up to. Same thing with the booster dose. Your immune system has been relatively quiet. It hasn't been seeing this virus. And so let's wake it up. Let's give it a booster so that if in the fall and winter months you're exposed, you'll be better protected. So the booster shots are recommended for the mRNA vaccines. And we know too that the expected path forward will be FDA review, FDA then asking the ACIP for their review, making recommendations for the booster. And if everything goes well with those 2 independent reviews, by the week of September 20th, we will be providing boosters to people in the state of Colorado. So with that, I will turn it back over to Brian.
Right, thank you, everybody. Or Dr. France, did you want to go over the...
Oh, thanks, Mo. Yeah, just this is a nice little slide that reminds us all that to be protected against this virus. On the far right, you see the woman standing there with her mask on, and on the far left are the viruses making their way to her. The more different kinds of barriers that we can create, the better chance that she will not be infected. And of course, these are interventions that are non-pharmaceutical in design, as well as now pharmaceutical with the vaccine. Staying at home if you're sick, good hand hygiene, getting access to testing, the exposure notification system. Each of these is a different layer that will help protect us from getting sick. And so, yes, it's important to be vaccinated if you haven't been vaccinated. And it's important to think of all these other kinds of protections that together will best protect each individual and our communities from getting sick. Thanks, Brian.
Thank you, Dr. France, and to all of our presenters. We're going to open things up to the media Q&A at this point. We're going to use the raise hand function, so you can go ahead and click that raise hand button, and that will put you in the queue to ask a question. Let's start out with first questions first, and then if we have time, we can get around to some follow-up questions after that. And when you start to ask your questions, please just let us know your name and which outlet you're from, and we'll start with Katie Eastman.
Hi, yeah, I'm Katie with 9 News, and I had a question. Why do you think there is an increase in RSV right now? And also, you said you're taking a deeper dive into ICU pediatric beds. Why is that necessary, and what does that entail?
Well, maybe I'll take the first stab at RSV. Last year, of course, was a very quiet flu season.
And are you guys able to go on camera and say this? And take away the media Q&A part?
I think so. Can you all hear me?
Yes, I can hear you, but I can't see you.
Okay. I'll wait till they have me back on or assume I'm on. I hope that does it for you. So.
Not quite yet. We still just see the slides.
Okay, it looks, you may be able to change that in the view menu at the top right of the window as well, whether it's speaker or gallery to, if Dr. France is speaking then.
Well, let's see if I start speaking, if that helps and you can see me. Let me go ahead and get started from a time perspective. Last year was very unusual. We had very little flu and very little RSV during the winter months. People were staying home, people were staying distant, people were wearing masks. And the end result was these respiratory viruses of the winter did not show up in Colorado. And so now here we are months later, and to our surprise, respiratory syncytial virus, RSV, is back in the community. In my 32 years of living here in Colorado, practicing as a pediatrician, I don't remember ever seeing RSV in August. It's a disease of November through February that led to large visits in the clinics and high hospitalization rates in bad years. So I think it's something unique about RSV that we don't necessarily understand that has it back here during the fall season. A fall right at the same time that schools are beginning, which may make it even more challenging for us. Regarding the ICU beds in pediatrics, this is not the time of year that there would historically be a lot of respiratory illness and children in the ICU with respiratory illness. It's the summer months still. And so with RSV going up and with these COVID cases and other respiratory illnesses, there are more children in ICU beds than we would normally see in August. And we believe it's important at the state for us to understand the capacity for ICU beds as we prepare for the fall. So Director Bookman and others are working with the hospital systems to better collect the data and so that we can quickly get a sense of capacity here in the state.
All right, how about Erica?
Hi, thank you. Erica Meltzer from Chalkbeat. What would you expect the impact on these hospitalization numbers to be from school starting, particularly given that we don't have some of the same mitigation measures in place as we did last year? And I'm also curious, I was noticing that the pediatric hospitalizations were also higher in the spring, and I was curious if you know what drove those.
It would be difficult to speculate the impact, particularly because it's fall. Kids will be outside more than they might be during the winter months of school. We know typically kids in school during the winter months leads to a lot of sharing of spaces and increased respiratory infections. There is some increase in respiratory infections when kids come back to school. I am not sure that I can explain the spring increase. I would say that whenever children, adults, families are getting together more, there will be more respiratory disease spread. And so I was seeing friends with minor upper respiratory illnesses over the late spring, early summer, after having gone a year with no infections. And so just the mere fact that we're all getting together, we're spending more time because COVID had dropped in numbers, means other respiratory infections will become more common.
All right, let's move to Zach.
Hi all, this is Zach Newman with 9 News. Thanks so much for this. Appreciate all your efforts here. So my questions are focused on the Colorado Exposure app. And so, Casey, how are you going to prevent abuse within this system?
Yeah, thanks, Zach. It's a really good question. So there's a very small opportunity for abuse within the system, but really that should be mitigated by the fact that folks know that they are acknowledging and attesting to the accuracy of the information when they go through that self-report process. That's step number one. So, making sure that folks know that they're accountable to accurately using it. I'm sorry?
Sorry, 9 News' website likes to autoplay. Sorry, hold on one.
And then the other pice that I
sorry, Casey, I'm sorry. Can you, because with broadcast, it's all going to mess that up. That's just so embarrassing. Could you please repeat that? So with, so you're saying there's a small area for abuse because of what and what's going on?
Yeah, I'll explain what that area might be, but also some of the mitigating factors that we have in place. First one is that folks attest to the fact that the information they're providing is accurate. Not only in the process of self-reporting, but when folks activate those exposure notifications, they acknowledge that they understand their accountability in the use of that service. So that's step number one. Number two is we always have to know which device to send those exposure notification activations to. And so the step where we verify that the person reporting or letting us know that they want to self-report is in possession of that handset. We confirm that they are in possession of the handset where that activation will be sent is another mitigating factor to make sure that we're only sending it to folks that are intending to use this in a proper way. If I were to speak to where the risks for abuse are, then of course someone could purport to be accurately reporting at least once. But if they try to do that again, there's actually controls within the national service for how those keys are anonymously maintained, which prevent a user from repeatedly trying to inaccurately activate an exposure notification.
Gotcha. And just so we've reported,
Zach, let's go. Zach, we're going to go ahead and stick with first questions here the first time around. But if you want to raise your hand again, we can certainly see if we have time for follow-ups at the end. Let's go ahead and move on to Esteban.
Hi, this is Esteban Hernandez over at Denver, right? So Denver has a relatively high vaccination rate. So I was curious, can anyone provide more information about breakthrough cases in Denver or the metro area specifically if possible? And also what percentage of hospitalizations in the metro area are breakthrough cases?
Yeah, this is Rachel. I can take that question. I don't have that county level breakdown for you right now. That's certainly something that we could look into and provide to you offline. But in general, I would expect that similar rate of hospitalizations occurring among vaccinated versus unvaccinated would be similar across the state. And right now we are seeing about 7 times the rate of hospitalization among unvaccinated individuals compared to vaccinated individuals. We can also look at that data as proportion data, but I think it's important to actually look at that data a little bit differently because the proportion data can be a little misleading. And the reason that the proportion data can be misleading is that we expect that proportion data to change over time as we see the proportion of people that are vaccinated grow and the proportion of people that are unvaccinated shrink. We expect to see a greater proportion of cases occur among the fully vaccinated population. And so looking at that proportion over time can be a little bit misleading. So I think the best way to look at the data is looking at the rate of infections that is occurring among the unvaccinated people and then compare that to the rate of infections occurring among vaccinated.
Thank you, Dr. Herlihy. Let's move to Gabrielle.
Hey there, this is Gabrielle from Fox 31. I had a quick question about reinfection as well. Are there any plans to sort of bring those reinfection cases to the data dashboard that's on the state's COVID-19 website, just so people can see how that is sort of unfolding in the state?
This is Rachel. I can take that question. I know that right now we are working on the vaccine breakthrough data and bringing that data to our dashboard. I think there's been a bit more demand for that type of data, but we can certainly look into also including the reinfection data on that site.
Let's send it over to Jessica.
Hey, it's Jessica Seaman with the Denver Post. When you're looking at the number of pediatric beds that are in use, do you know how many of those are from patients that might have been transferred from out of state, particularly in some of these southern states that are reporting that their pediatric units are filling up?
It's a great question, Jessica. And right now, we're not looking at that level of granularity into whether patients are transferred in-state or out of state. We are working closely with our pediatric receiving facilities to ensure that they have the capacity that they need. And they evaluate on a case-by-case basis what transfers they do accept and what transfers that they don't accept. I think it's important to acknowledge the fact that pediatric care is incredibly specialized. It tends to be consolidated into very specialized hospitals, and that they have catchment areas covering multiple states. And so we really do see that pattern of transfers continue, not necessarily from some of the southern states where we've seen capacity overwhelmed, but we are evaluating it all on a daily basis.
All right, let's move on to Dan. Dan, we got your message if you're available.
Yeah. Hi, my name is Dan Beatty with KRDO News Channel 13 down in Colorado Springs. So last week, School District D49 in El Paso County said they will not report individual COVID-19 cases to county health officials. Yesterday, Governor Polis said school districts are required by law to report cases to county health officials. So our question is it unlawful for a school district to not report individual COVID-19 cases? And is it unlawful for a school district to not report a COVID-19 outbreak within a school?
Yeah, this is Rachel. I can take that question. So our state statute and our state regulations, so Colorado law, does outline that both cases of reportable conditions in COVID-19 would be considered a reportable condition, as well as suspected and confirmed outbreaks are required to be reported to public health by law. So that certainly is a requirement here in the state and would be an expectation that those cases and outbreaks would be reported to either local public health or the state public health agency.
Right, and then Sarah.
Hi, this is Sarah Mulholland with Colorado Public Radio. I had another question about the Colorado Exposure app. I'm wondering if you guys have any number on how many notifications have been sent, how many exposure notifications have been sent since it started, and also if you've had any problems with multiple notifications being sent in error.
So I think I'll take that first part of the question. I don't know if you want to answer more of it at the end, Scott, but we do have statistics on all of the codes that have been sent as well as those that have been redeemed. And I can also report that we do not know of any number actually being sent in error. And there's a lot more information we could provide around all of that, which we'd probably take to an offline forum if need be.
Sure, that sounds good.
All right, and then Victoria.
Hi there, this is Victoria with 9 News, and I'm looking at the state's new quarantine guidance for schools and childcare settings, and it looks like most students and staff would not have to quarantine after a positive case, depending on vaccination rates in the county and in the school district. So my question, shouldn't there be a concern about like school outbreaks, especially in students younger than 12 who have not yet been eligible to receive the vaccine and with a more transmissible variant circulating?
So the guidance that we put together does include information about situations that would be considered lower risk versus higher risk. And in those higher risk situations, the use of quarantine is certainly going to be recommended. But in those lower risk situations, so when both parties, the individual that was infected and the individual that was exposed, were wearing a mask, other settings like routine testing occurring, low case rates, and those types of scenarios, we do feel that quarantine would not be necessary at this point for routine classroom exposures. And again, that is all in our current guidance that is available on our website. And certainly we recognize that local public health has the authority to evaluate the conditions in their county and apply that guidance as they see appropriate in their individual county. And for some counties, that may mean implementing stricter guidance than what we have in our state guidance at this point.
Okay, thank you. So it sounds like this would, really be like a case-by-case basis.
Yes, and we certainly, that's how we lay it out in our guidance, that there are lower risk and higher risk situations. And really what we're trying to do to really try and increase the chance that our kids can stay in school and learn effectively is to use a layered approach, very similar to what you saw Dr. France present with that Swiss cheese model, really. So using all of these different strategies to try and keep our kids safe, to minimize disruption to education.
Right, thank you. We're going to be out of time here for the media Q&A session. Any additional questions that you might have, any questions that were not answered in today's press conference or questions on topics that were not covered in today's press conference, please feel free to email us at media_info@state.co.us. Thank you, Director Bookman, Dr. France, Dr. Herlihy, and Casey for presenting here. And thank you for joining up with our presser this morning. And again, follow up with us at media_info@state.co.us if you have any other questions. Have a good afternoon.